Good afternoon. My name is Peter Nilsson from the Lund University. Today I will address insulin's 100 years anniversary and how it was implemented in the Baltic Sea area. I'm also head of Department of History of Medicine at my university. As you know very well, insulin was discovered and developed in Toronto, Canada by Banting and Best, MacLeod, and other colleagues way back in 1921. The first patient was treated with insulin from pigs, porcine insulin in early 1922. The first experiments were carried out in dog series, a famous beagle dog named Marjorie that survived 60 days after pancreatectomy and a substitution with this pancreatic insulin extract given by the researchers. So it was a major breakthrough, and later on it was awarded with a Nobel Prize. Insulin type 1 used to be a deadly disease in the early days before insulin. Many children, young people died, unfortunately, because of this disease when dietary treatment was the only one available. However, when Banting and MacLeod were awarded the Nobel Prize, this started a new area of insulin treatment, not only in Canada, but spreading also to United States and Europe. Nobel Prize was awarded in 1923 for the discovery of insulin at a ceremony at Karolinska Institute, as seen here. The first report was published in Canadian Medical Association Journal 1922. Here you can see the deleterious effects of type 1 diabetes without treatment in a girl to the left, but after insulin treatment 4 months, she recovered very much, and this was, of course, essential for survival. This is a close-up photo, and you can see how healthy she became on the right photo just after 4 months of insulin treatment. In the early days, insulin was crystallized and used for tablets to be dissolved in water. After a while, it could also be produced as a fluid insulin for injections directly. Otherwise, you had to take the tablets and dissolve them before injecting. This is the famous August Krogh from Denmark, professor, physiologist, with his wife Marie. August Krogh was awarded the Nobel Prize in 1930 for studies in the microcirculation, but he and Marie went to Canada in 1922 to meet with Banting and Best and to learn about insulin therapy for type 1 diabetes. They brought this idea, this patent back to Denmark and started industrial production of insulin. Later on, another Danish physician, Hans Christian Hagedorn, developed another version of this insulin, NPH insulin it was called. So it was all based on ethanol extraction of the hormone from the pig porcine pancreas. So it started in 1922. Danish experiments took place in December 1922, and early 1923, industrial production started. This was quite a big step because still today, Denmark is a leading nation for insulin production. We have the famous Novo Nordisk drug company. But from these early days, it was stated that the revenues of Novo Nordisk, some of it has to be put into a scientific foundation to support science. So every year, lots of money is spent on science based on the revenues, the income of Novo Nordisk. Here you see how complicated it was to extract insulin in the early days through this extraction process. Both Dr. August Krogh and Dr. Hans Christian Hagedorn were later honored, for example, on stamps. And you can see that even if Denmark is a small country, it contributed very much in medicine for the development and introduction of insulin in the Nordic Baltic Sea area. And this I will expand on. In Lund, Sweden, we had an early pioneer, Professor Erik Widmark. He was a professor in medical and physiological chemistry. He was interested in how insulin could be dissolved in different fluids and published his studies in 1923 as a contribution from basic science. However, the great pioneer in clinical medicine was Professor Carl Petrén at the hospital in Lund. He was a professor of internal medicine, very interested in diabetes. He developed a fat-rich, carbohydrate-low diet to treat diabetes. He even published a monography in 1923 on dietary treatment of diabetes. However, the same year, insulin was introduced, and he was eager to test it in his patients. Later on, he was even honored by American scientists for his early work on dietary therapy of diabetes in the pre-insulin era. This is a slide from a textbook, Ergebnisse der Inneren Medizin und Kinderheilkunde, published in Berlin 1925, with a contribution from Carl Petrén, Lund, Sweden, is stating his interest in the treatment with insulin for different clinical conditions. So already at that time, he collected his experiences and put them into this textbook. Here is a scientific publication from 1927, the year he died of stroke. Petrén died that year, but this is a summary of his clinical experience from 57 cases of diabetes coma treated with insulin at the Department of Internal Medicine in Lund. And as you can see, the first case was recorded in May 1923. And as I told you previously, the industrial production of insulin started in Copenhagen, Denmark, just a little bit before that. So it was sent to Sweden, and Carl Petrén used that in his patients. Also in Stockholm, other physicians were very active during this time. One of them were this female physician, Dr. Andrea Andrén, at the local hospital in Stockholm. She was interested in diabetes, used insulin early for treatment of her patients with diabetes. There was also another physician in Stockholm, Joshua Tillgren, and both were early pioneers in the Stockholm area. It's quite interesting to know that way back in 1981, some Malmö physicians wrote a case report of a patient with insulin-requiring diabetes of 60 years duration, starting early in 1922, when he was only 15. So he was in a rather healthy state when they saw him in 1981. And this is just proof that early insulin treatment helped young people to survive, even in good medical conditions, as shown here. I was also interested to learn more about the introduction of insulin in the Baltic Sea area. So I wrote to my colleagues in different countries. I had some replies from Estonia, where a German manufactured insulin was started in 1925, insulin Kalban. Later on, the Danish insulin Leo was introduced in 1934 because it was cheaper. In Lithuania, there was early export of pig pancreas to Denmark for the production of insulin. And in Denmark itself, the manufacturers were Insulin Leo, later on Novo Nordisk, but also very early another company producing dia insulin, mostly forgotten, but there was some fighting between the early companies because of the patent, because of the production, different names, different brands, but later on Novo Nordisk was the main manufacturer. As I mentioned, in Lithuania, Novo Nordisk and this Dr. Hagedorn wanted to promote the export of pig pancreas to Denmark. That started in 1936. Later on, in 1950, the Lithuanians have already started producing their own insulin for injection, and I guess it was similar in other parts of the Soviet Union during that time, in other Baltic parts of the Soviet Union. I still miss more precise information from Latvia and Finland, but I will try to find out. So in summary, insulin was discovered in 1921, first given to a patient in early 1922 in Canada. The pioneers were awarded the Nobel Prize in 1923. Dr. Krogh and his wife Marie came to Canada in 1922 to bring it over to Denmark, and industrial production commenced in early 1923. In Sweden, this Professor Carl Petrén was an early pioneer to start insulin treatment in his patients with diabetes coma in Lund in May 1923. Slowly, insulin was introduced to the other countries around the Baltic Sea. And finally, this historical example of the transfer of knowledge and also the medical treatment by use of insulin can be used as a model for further studies. Thank you very much.